We're going to talk a little bit about the Rinn holders. They get their name because they're made by a company by the name of Rinn, but there are several different brands on the market. So we're going to try to show you the variations between the older models and the newer models without confusing you too much. The non-color coded are the older ones, and because this is pretty much indestructible plastic, you'll probably find many offices still using these, because until they get lost or totally worn out, you can use these over and over again. And although it's plastic, this is a special plastic that's heat resistant, and everything that you see here is autoclavable. The newer ones are color coded, I guess to help you from assembling them incorrectly, but they're basically the same. We also have a slight variation in technique. This particular film holder is called the bisecting technique, and these, the blue and the yellow, are the paralleling technique, and we'll put these together and show you the difference. The difference is very slight. No office is going to use both systems. They're either going to pick one or the other, and the X-ray technique is basically the same for both. You'll notice that the bars for both systems are the same. There's no difference in the bars. However, the bars are not interchangeable. This happens to be the anterior bar, and then this is the posterior bar. Also, you'll notice that the rings are different. The ring on your right is an anterior bar, and you'll notice that the anterior ring, I should say, and you'll notice that the bar is exactly in the center of the ring. This is a posterior ring, and you'll notice that it's slightly off-center from the ring. So that's how you tell the anterior from the posterior. This is centered, anterior, this is off-center, this is posterior. And in the newer models, the same is true. If we hold these up, you can see that the blue on my right, on your right, is the anterior ring. Again, it's centered. The bar holder is centered. And on your left is the posterior ring with the bar holder slightly off-center. Also, they have color-coded these film holders to keep from doing this, putting the anterior film holder with the posterior ring. However, we're going to show you how that mistake shouldn't be made with either system. Let's start with the older system first. And as you know, anterior X-rays are supposed to be taken with the film straight up and down. So this is an anterior holder, and this plastic serves absolutely no purpose except to remind you that it's an anterior holder and that the film goes this way. You could just as easily put the film in this way and it would stay in there. However, you're missing your little clue right here, which is telling you that it's an anterior Rinn holder, an anterior film holder, I should say. So you know that the film holder is straight up and down, vertical as we say, and the ring is in the center. So this is the anterior ring and the anterior Rinn holder. So we're going to put them together like so. And again, the final test is you look through the ring and the film should be in the center of the beam. If it's not, then you're not going to get an adequate X-ray, because remember, the X-rays are going to come through this ring and strike the film. Also, the film always needs to face, the white side of the film needs to face the tooth and faces the X-ray beam coming through. You should never put the film in like this with the green side facing the X-ray beam. Always think of white teeth, white film. The teeth are going to be biting here, so put the white side of the film next to the teeth, not the green side. All right, so that's the anterior Rinn holder. And let's put the posterior one together. Let's put it together incorrectly first so you can look through it. Now, as you look through that, you can see that the film is no longer in the center of the circle. That's because I have the ring assembled incorrectly. So I'm going to flip it around, and now it is in the center of the circle and it's assembled correctly. This offset is to clear the lip. The way this film is set right now, it will either take the upper left or the lower right. We'll show you that a little bit more in a minute. Let's look at the color-coded ones, and they go together the same way. Here's the posterior color-coded one. This happens to be the paralleling bite block. And again, we're going to put it together. Whoops, I've got the wrong bar. And we're going to assemble it and do our final check. And again, we see the film in the center of the beam, and we're going to put the anterior paralleling bite holder together. And once again, that is in the center of the circle as well. Now let's see the difference between these holders. Okay, we've got both posterior versions assembled here, and we've got our patient here to show you that there's really not much difference between the two. This is the so-called bisecting angle technique film holder, and this is the paralleling technique. But you'll see when we put them in the mouth, the differences are almost non-existent. We're not going to put the film in here for illustrative purposes, but this is how you would take the x-ray if you were using the bisecting technique. You would put it in the mouth like this, and then have the patient bite on the little step just in front of the film, and then slide this towards the face. You'll see that in the bisecting technique, the film is fairly close to the teeth, and that's good. There is a little bit more distortion with the bisecting technique because the film is angled slightly from the direction that the teeth are growing in, and that's its only criticism. Let's put the posterior paralleling holder in, and we'll see what that looks like. Again, because of the roof of the mouth and because the film holder is almost straight up and down, it is in there like that, and it's pretty much in the center of the mouth. In other words, when the patient finally bites down, the film is in the center of the palate as opposed to being close to the teeth. So that's the difference mainly between the two Rinn holders. But again, the positioning difficulty is not that great. You only have to take an adequate x-ray. It doesn't have to be a perfect x-ray. If the x-ray shows the detail of the teeth that is supposed to be shown, then the x-ray will be fine. Let's look at the two versions of the anterior holder. This happens to be the paralleling technique. And again, you can see that the film is back quite a ways from the tooth. Here we're taking the upper central's periapical. And again, because this is a parallel technique and the film is straight up and down, it can't get close to the tooth because there's no room for it to stand straight up and down. But then this would be an adequate periapical shot. Let's look at the anterior bisecting angle technique, and we'll use the film on this also. This time we'll be able to put the film a little closer to the teeth and have the patient bite down on the little ledge that you see right there, and we'll move the ring up close to the tooth. And again, you can see that the film is a little closer to the tooth, but to the untrained observer, it looks like you're positioning both films pretty much the same way. And so it's really splitting hairs as to which technique, the paralleling technique or the the bisecting angle technique is the better technique. Your office that you work in will use one version of the holder or the other, but they won't have both of them. Just depends on the preference of the dentist.